6:30 p.m. And we'll go ahead and do a roll call.
Okay. Ms. Conlon?
Here.
Mr. Clark?
Here.
Mr. Markison?
Yes.
Ms. Clark? Here. Dr. Hansler?
Here.
Ms. Moravsky? Dr. Katz?
Here.
Ms. Gaffney?
Present. We don't have any public participation, do we? No?
No.
Okay. We have a motion to approve the October 16, 2023 minutes.
I'll make a motion to approve the minutes.
Thank you. Second.
I'll second.
Any corrections or changes? Further discussion? Darlene?
Okay. Mr. Clark?
Yes.
Ms. Moravsky?
Yes.
Ms. Carmen?
Yes.
Mr. Markison?
Yes.
Dr. Katz?
Yes.
Ms. Clark?
Yes.
Ms. Gaffney?
Yes, thank you. We have 3 employee recognitions this evening. And we'd like to recognize Ashley Beanick. Beanick?
Yep.
Would you like to tell us about her?
Yeah, Ashley has been with us for about 5 years now, or actually 5 years at her anniversary. She started with us as an ACO. I think she did that for maybe a year or so, and then she has 2 small young ones at home, so she decided that she wanted to do something that didn't have as much after hours or over the evening. So she started working in the office, so now she's a part-time administrative specialist with us. She does a great job. The nice part about having Ashley is since we have had some lower staff at times, because she was an officer, she was rabies vaccinated, she's been able to help in the clinic, in the back, she's been able to help out in the field, she helps at all of our clinics, so she really is very versatile to what we do, and we really appreciate her 5-year longevity with us.
Well, congratulations, Ashley. Our second recognition is Nancy Crest.
So Nancy Crest is in the nursing division as a WIC nutritionist. She is truly an expert when it comes to WIC. She worked in WIC outside of our county before coming to McHenry County. And she is recognized internally and externally across the state as being one of those WIC experts. So we appreciate that knowledge being here. She's very passionate about her program and providing the essential services that WIC does to our residents.
And it's 10 years of service, so thank you very much. And with 15 years of service, Janet Villagomez.
Janet is also in the nursing division. She started with us on the IBCCP grant. She was hired as an administrative specialist. She also helps out with the Illinois Wise Woman that's connected to that Illinois Breast and Cervical Cancer Program. Because she has been there since the inception of this program, she's extremely knowledgeable about the grants and the deliverables. And she really, it's a very highly reported grant that needs to be done, and she is definitely somebody that keeps that grant organized and has those reports ready for us to report out on. And she's also, again, one of those experts in our community where the residents know to call her if they have questions about their provider, and the providers also call her for any help that they need for claims.
Wonderful. Thank you very much. On to the consent agenda. Oh, sorry, Department of Division updates. Melissa?
Sure, just keeping you updated on ARPA. So we've met with the county, we've had a series of meetings. I just sat down today with county admin, county finance, and the chairman of the board, as well as the chair of the finance committee. We're trying to wrap up essentially our proposed projects and plans. And essentially we have a complete plan for all the funds to be earmarked. Now, all the final costs as we go through, go out to quote, an RFP process, some of those dollar amounts are likely to change. We just last Friday met with the director of facilities to review a tentative plan for the Crystal Lake improvements. So the next step is wrapping that into a resolution to bring forward. So we plan to bring that here in January and then move it through the county process, because it's probably going to take about a year, 9 to 12 months to go through that whole process just to get ready to do the actual renovations before the project work would start. And so I'll be doing an update and a presentation at the next Public Health and Community Services Committee on the county side as well as Finance Committee. And then when we get to the financial stuff, I can.
You can go ahead.
Okay.
She's going to report for Karen, who's not feeling well tonight.
So we're just, we're wrapping up fiscal year 23, winding down some of those expenses, working on, so a few months ago, we had added the SIPA grant, that's that strengthening, I'm going to forget the acronym, but basically it's the strengthening the workforce grant where we're going to get $350,000 from the state. We just have not received that money, so it's not added. You don't see it in the budget yet. So depending on the timing of when that check arrives, it may hit this budget cycle or the next. So we will have to get that sorted out. So we're just wrapping up purchase orders. We have to roll forward dollars at the end of the year for expenses. So our state grants cross a fiscal year. So we move monies forward from one year to the next. So that we can expend those down. And then, which is on the agenda tonight, it's the Comprehensive Health Protection Grant. And because it increased so much, it is one of these grants that we're going to bring forward to the board instead of having me sign it initially and then bringing it here for you all to accept. There was, in this last year, the state increased the Comprehensive Health Protection Grant, specifically the local health protection piece of that grant by $6 million. Mm-hmm. We are going to see $162,000 of that in our local health protection grant. We saw increases in other parts of that grant, which include body art, tanning, vector, and tick surveillance, and then we saw small decreases in perinatal hepatitis B. So that's on the agenda tonight, but it is the largest increase that the state has done for this grant in about 25 years. The last major increase was $3 million in fiscal year 2007. So they came up with a formula basically to apply to every health department. And we were one of those that received a big increase. So the total increase is $183,698 from the prior year. And we're going to be using those dollars to, for our answering service, because that is a required component, association and dues, right? We want to make sure our staff are getting out and exposed to professional membership organizations, attending national trainings and meetings, because we often don't have funds for that. And then our translation service that goes beyond just our bilingual staff, and website development. So those are some of the things that we're going to use those dollars on.
Any questions for Melissa as relates to her report or Karen's? Thank you. Director Karras?
So my report's going to be really short tonight. Respiratory illness we are starting to see that. It is increasing, but we are at or below our benchmarks for this time of year. So it's nothing unusual except that we know it's coming. We're starting to see it in the same age groups that we typically see it in, particularly the children, before it hits the older adults. Now, COVID is a little bit different. We're seeing it in the older adults versus the kids, but it might be just the testing is done differently for those populations. We have also ordered our COVID vaccine for our staff here at the health department. It has not arrived yet, so we're still waiting on that and have not gotten an ETA from our vendor. That's all I have.
Thank you. Any questions for Director Karras? Thank you. Director Hall?
Thank you. I don't know if you recall last year when we added the reckless dog owner to our ordinance. Basically, a reckless dog owner could be defined as an individual who has pled guilty or been found guilty of 3 violations of the animal control ordinance, that section of it. Now, we did discuss when we implemented that obviously we're not looking for simple, you didn't register your dog kind of violations. Well, we had our first case go to court last week. It was in mind a pretty severe case because I would say the individual had probably 15 or so violations.
not found guilty on all of those violations or pled guilty on some of those violations. But in the end, we were able to come to an agreement. The judge decided that, yes, this person probably, for good public health reasons, should not own a dog for 3 years. So the individual dog is placed with somebody else in this case. But I think it was an important step for us to see how that went, see how we took it forward to the courts, see what that looked like, right, how that would present to the courts. And I think we had some lessons learned there for the next time we do it, as well as the fact that we felt truly that we needed to get the reckless dog determination, and we were successful in doing that. So I just wanted to let you know that we had our first case go to court for that. Last year, we also implemented the steps for the ACOs. I'm happy to say that we have some applicants coming in who actually have some ACO experience, right? We're enticing them to come to McHenry County. We have some steps to put them into if they have had some experience, some of the certification, years of experience and such, so we're kind of excited about that as well. And then the last thing I didn't have a chance to let you know about before is NIU did a project for the county that had to do with animal control. So they were basically looking at our whole process, our policies, the different types of services we offer, and just looking at a higher end level of what we do. We don't have the results of that yet. I understand there was a presentation for the other students in the class today. We didn't get to hear that because I was in court on a different situation. But once we get the results of that, of course, we'll let you know what came through on that assessment. I'm venturing to guess, though, one of the things that I figured out going through that process is we really do transfer a good amount of animals. We have no issues transferring animals to other organizations that can assist us in getting them their forever homes. And also, we only bring in about 15,000 a year in adoptions. So compared to the I can't remember the exact number, 1.2, 1.3 that we bring in animal control, only about 15,000 of that is adoptions. Now, of course, it takes a lot more money to get those animals ready or to take care of the animals that don't go up for adoption or get transferred. But I did find that to be an interesting number for us. That really isn't an important number compared to what we bring in. So, Melissa brought up the remodel. We're still working through that just a little bit, and we're excited to see that get to the next step in the ARPA funds. So.
Thank you. Any questions for Director Hall?
I have a question. On the case of the reckless dog owner, can you give an example of the more egregious of the 15 violations? What are we talking about? They were
Many running at larges.
okay.
Running at large with an unfixed animal, unvaccinated animal. That's a public health problem.
So this was in an area where people were calling. This dog was kind of on the loose, so to speak.
Multiple dogs.
Oh, I see. Any injuries?
Yes, not a severe injury in this case, but definitely something that we were concerned about. One of the reasons why we brought the case forward for the reckless dog owner.
Okay, thanks.
So,
Is this survey that Mary Ellen was talking about, the one that we discussed, the survey sent out to me?
yes.
Did that get modified at all? And
Yeah, I believe it did.
I never got another survey.
There was a phone call between the county and,
I know they talked about sending another survey out. I did not hear whether they sent that second survey out or not.
Do you know who participated in the survey? Who initially got
Last
the
I
survey?
heard, only one.
What, pardon me?
Only one,
Me?
last I heard.
I didn't participate in it though.
Oh, well, somebody did.
Oh, okay. So really the data is not, it might be interesting to note that you did all your side of it with the transfers and everything, but the way the survey was written, it was written to kind of say, can we do a better job on the outside by, kind of, it was sort of steering towards, if if we gave you money to take more animals, would you take more animals, or could you do a better job in animal control? That's the gist I got in it, because we had gone through this 15 years ago before the building was up. So were there any surprises, other than what you mentioned?
I don't have the final results, but I don't think there's gonna be any surprises in there. The truth is, we already vet animals that we transfer since COVID, because it was very difficult to get the transfers done during COVID. So we have been vetting those animals, getting ready for adoption before we transfer. So I don't see the difference between doing that and giving them the money to do that. Sort of the same thing.
Where, if only one response was done, where did they get the data from then?
I guess we'll see. I guess we'll see what data they were able to put together. I think what their recommendation will end up being is that this is you need more information, you need more data. So.
And they did a presentation on it.
Which we didn't get to see today.
I would love to see it, so if you do get a copy, we'll send it to me. I'd be curious. Yeah.
But I'm sure we'll get the report.
This was done by a student in NIU?
So the county, I think every year, they have a relationship with NIU. So I'm not exactly sure how they vet the process, but I think students come up with ideas about projects anywhere in the county, right? Any department to look at, and then somehow they match them up or make a selection. We weren't really included in that process, so we found out afterwards that animal control was one of the projects that they selected. So
because I got an email.
Yeah.
And it was, you know, I had no idea, one, who the authors were, okay, for the email. And it listed multiple questions. And I originally thought it was young students doing this. So my thought process, well, forgive them for the errors and the things that they stated, but that just didn't appear to be the case. It was adults, more senior adults, over 25, in a class that should understand how to send out a survey. So it wasn't well done. That's my concern, that the data is, how viable, how
I think we
viable is
won't
the
know
data?
until.
If we get some lessons from it, then that's.
No, and I agree. I would hope that they would send out a different one, you know, one that's really gets you better data.
Yeah, and I think that might be part of their recommendation is you need to get some more information. This is what you can do next if you want to get more information.
Or and reach out to you to craft it even, you know, would have been interesting.
No, thanks.
Anyway, thank you so much. Any other questions for Mary Ellen?
Mary Ellen, did the reckless dog owner know that immunizations can be given through the health department?
Given by us?
Yes.
Oh, yes, they have brought their dogs there in the past.
Oh.
When this is
And he
years
just
of violations.
chose not to do
Reckless.
that. Yeah.
That's the definition of reckless. We don't take it lightly, so.
Thank you. Director Noel?
So several months ago, I mentioned that we were partnering with solid waste agencies and programs in Northeastern Illinois and the Metropolitan Mayor's Caucus to apply for a US EPA Recycling Education and Outreach Grant. And so the group was notified actually just this past week that we were one of the recipients of the grant. So I really the information I could not find the amount in there.
Oh.
So I can't.
$1.
Well, it was, yeah, fortunately it was a little more significant. I mean, we're eligible up to $250,000 for a multi-year grant. But I was just gonna say that the next step is for the EPA to appoint a contact to the group, and then they will negotiate the final work plan and things like that. So I'll bring more information back as we have some more details with it. Also, we're moving into the testing phase with SmartGov, which is the vendor that is working with planning and development and environmental health for digital septic and well permit submissions and reviews. So we're excited about that. And then finally, one of our ARPA projects was expanding capacity in our laboratory, and we've received all of our new equipment, and we will be training with the company that provided it just after the new year to then move through our accreditation process. So we're excited about that. That's all I have.
Thank you. Any questions for Director No?
I do have a question, Patty. So I read recently about Marengo and triethylchlorine, is that what it is? The groundwater was being contaminated from some factory that was just dumping stuff.
Oh, that's 300, right?
Is this the magnets?
Is it
Yes,
triethylchlorine?
Yes, so there's an existing groundwater contamination site that's been under review for quite a few years. And so that is under, I do get updates on it. In fact, I got one really just fairly recently. So it's still in the process of finalizing the remediation plan, so there's a lot of work that goes into that. Our involvement with it was with some of the properties, working with the Marengo and Department of Planning and Development. They were converted from private water wells onto community water, right? So that is it. And then, so there's a lot still going on with that, but I believe that's the one you're talking about.
Yeah, I think so, because, well, I think I did not realize it was the chemical itself, which is pretty nasty. But did they ever decide what they were gonna do with this Project 300 or whatever? Did they, because I know there was some issue with who's gonna pick up the tab or who's gonna be responsible
Right,
for it.
and that's still in process, and so they're still negotiating with the EPA and their site remediation program to come up with an acceptable plan. So the last I read in the latest update was that they're requiring additional sampling and some other things before they get to that point.
Are most of those folks drinking bottled water?
The properties that wanted to within that direct area were allowed to connect to community water. In the past, they were providing them with bottled water, but I think that would be very limited based on the number that connected. So I don't have that exact number for you.
Let's hope they don't just keep drinking that, because that's nasty.
I mean, to go back to several years ago, we met with them
Right.
out there and met with several family members, or not my family, but several families in the area, and got a lay of the land, so to speak, and then their attorneys approached us and asked us to, if you recall, to basically forbid the use of potable water in the area, because for reasons that may be beneficial as part of an ongoing litigation. You kind of get the idea of where that's headed, but Marengo was it was a big deal running water out to them, so.
Absolutely. From a public health perspective, I mean, it was a wonderful thing
Yeah.
to happen, you know, just for long-term protection of those, you know, properties and those individuals, absolutely.
So basically, it's still ongoing.
It is absolutely ongoing.
It's terrifying.
Thank you.
Any other questions for Director No? Dr. Merritt?
Thank you. So we've begun working with GovHR on the succession planning. An employee survey was developed and links were sent out to us. And we are working in groups to get them completed. We figured that if we did it with each division during their staff meetings, we would have more people answering the surveys, and that way we can incorporate everybody. So environmental and administration took the survey last Tuesday. Tomorrow will be animal control, and the 28th will be nursing. So we're very excited to get this completed. We've sent GovHR all the materials that they requested for their review, including all of our job descriptions, org charts, the strategic plan, our budgets, our own kind of overview of our beginning of succession planning as far as retirement years and how many could be retiring within 5 years, 10 years, et cetera. So we will be meeting with GovHR to review, focus group times and schedules, one-on-one interviews that they'll be conducting with the employees as well. We are working on employee evaluations, so those are being completed and will be submitted by Wednesday, so we're excited about that. We had an active shooter training at the Crystal Lake facility on Friday, November 17th. They were able to do a walkthrough with staff too and have questions answered as to, hey, where do we go, or what is this, and what should we do here, including testing the panic buttons, so that was a good thing as well. Next will be administration and environmental here in the admin building, and we will be working with Woodstock Police Department, so that'll happen after Thanksgiving. And that's all I have.
Thank you. Any questions for Director Merritt?
Just a note on the active shooter training. This is something that, you know, it's coming, right? These are becoming more prevalent, and on the fire and police side, we're training for this more now, but it still remains something that we don't train enough for. I just recently, last month, attended a really large scale exercise in this, you know, where there were fake victims and gunfire and smoke and the whole thing. It was, you know, a whole day. My whole point with this is those training, everything we can get is beneficial, but I would encourage, you know, all divisions and the department as a whole, if possible, to reach out to some of our agencies and offer space to train, because sometimes that's a huge hurdle. I mean, it's always an overtime issue for these departments, for any organization, but sometimes getting a foot in the door with a place that has space to conduct something like that could be really beneficial to both our employees, but also the people that are gonna be coming to help us, so might be something.
So you mean develop that relationship with, on like the fire rescue side, is that what you're saying? Or
I mean,
police as
I
well?
don't know in this county as well, but if there's an organization like Woodstock or Woodstock Fire, or, you know, if they're working together with Woodstock Police or the Sheriff's Department and they're interested in putting on a large scale drill, you know, I think that's a very valid use for our facilities. Find something maybe off hours, employees if they want to volunteer for play victim, that sort of thing. But
Yeah, they've done that with the MRC. We've done those trainings, and people have schools volunteered. Kids like to pretend for, you know, laying there, you know, as a victim. So yeah, it's been done. Yes.
yeah, I mean, and now with the ARPA dollars, I'm assuming there's a possibility for funding for some of these things, maybe. But it just came to mind because you mentioned them. So.
Thank you. Anyone else? All right, on to the consent agenda. Do we have a motion to approve the consent agenda?
I motion to approve the consent agenda.
I'll sit.
You were so quiet.
Thank you. Do we need anything to pull out of the consent agenda for discussion? Anyone? Darlene, can we have a vote on the consent agenda?
Mr. Clark?
Yes.
Dr. Amsler?
Yes.
Ms. Clark?
Yes.
Ms. Morosky?
Yes.
Ms. Harmon?
Yes.
Dr. Katz?
Yes.
Mr. Markison?
Yes.
Ms. Gaffney?
Yes. On to new and unfinished business, 7A, the merit increases. Melissa, is that you?
The Personnel Committee met about 2 weeks ago now and reviewed a proposal which originated out of the county administration addressing merit increases for our employees for the upcoming fiscal year. Various options were discussed as how to distribute the increases. A motion was made and seconded and passed unanimously by the committee to offer a 4% across the board increase for our employees that are eligible.
That's your committee recommendation then?
Correct. So that is my motion.
Do we have a second?
I'll second.
Any further discussion? That was simple. Darlene?
I'm sorry, who made the first motion?
I did.
Thank you. Dr. Katz?
Yes.
Ms. Clark?
I refrain.
Abstain. Abstain.
Abstain, right.
Just say no.
Dr. Amsler?
Yes.
Mr. Clark?
Yes.
Mr. Markison?
Yes.
Ms. Carmen?
Yes.
Ms. Morosky?
Yes.
Ms. Gaffney?
Yes. We have a hearing from the committee findings and recommendations on the Hungry Truck Company. Kyle, would you like to?
Yes, thank you. So the hearing committee met for the first time in my recollection, which I don't know how long it was.
It's probably been a decade or so.
It's been a minute. So we were approached through appeals process. an issue came forward through environmental health for a food vendor known as Hungry Truck Company. This particular vehicle based out of Lake County. I'll cut to the chase here. The proprietor was looking to get a mobile, correct me if I'm wrong, but
Annual mobile food establishment.
an annual mobile food establishment permit, like a vehicle permitted, so they could use it all throughout the county. One permit to go to all the events, and everything was handled. She was, she's already permitted in Lake County, portions of Wisconsin, all of Michigan, and she particularly was, I think, more frustrated that part of the permitting process for us was also to require a plumbing inspection because her unit actually has plumbing in it. She felt like the permitting should have carried over, there should have been some reciprocity, we held a finding of fact. We went through troves of emails that she had gone back and forth with Director Nome and division staff, and there's other, instances in there. We did find that, she's tried to follow a lot of the steps. It's not always as clear as maybe we'd like online, so we definitely some lessons learned, ways we can streamline, ways we can improve. In large part, I think part of the frustration on her part was she didn't feel like she was getting timely responses to some things. And in some cases, there were some gaps of email responses on the part of our staff. So that was something we discussed. Obviously, I think our staff do a tremendous job, but they're also human. There's a lot of things going on. Things can get dropped or missed, and we've discussed, and I have my full faith in Director Nome and trying to tighten that up. And in the end, I think that was primarily the reason that she went through the process of bringing this to the hearing committee. In the end, we did find that Director Nome and her staff performed as we would expect them to, following the letter of the ordinance. That gives us wide latitude to require such inspections such as the plumbing inspection. So the hearing committee, the three of us, Juliana, Cindy, and myself, have a unanimous proposal to this board that we should deny her appeal and that our staff acted appropriately. So
But I think
the appeal specifically was, I apologize, sorry, the requirement to have a plumbing inspection by a licensed plumbing inspector. And at the hearing meeting, I didn't believe she was a little surprised to learn that the plumbing inspection costs nothing. And that Director Nome went so far to try and help and ameliorate the situation to get that all handled, 2 inspections done at the same time concurrently, 20 minutes out of her day, and this whole thing could be put to bed. So she seemed a little surprised to hear that. I think she was grateful for that interaction, but she wanted to make sure that the process got followed, and that's why she continued the appeal. So the last portion of it is I would recommend to this board that we deny her appeal. And I believe, I've been interested, Director Nome, did she follow up and complete her inspection?
No, we've reached out to her twice and we have not received a response.
Okay, very well. Forgive me, have I covered it all? Is it clear? Does anybody have any questions?
The only question is, so other counties don't require the plumbing inspection at all? Is it?
Well, it's not really an apples to apples situation. I can't speak to Michigan, what they require in their jurisdiction, but the permit that she operates under in Lake County is a temporary health permit. So Lake County looks at mobile food establishments differently. And so we do require it. We're issuing an annual permit for them to do it throughout the county anywhere, and that requires an additional, protection in there that it does meet standards. And it's what we have required for every single one of them that has opened in the county. So not all of them, but not all of them are the same types of permits like this.
Okay, I was just curious how that, yeah.
I think it's worth pointing out too that we went an extra step to facilitate her being able to even operate her business during one particular event by issuing her a temporary permit, which we offer for these establishments, even mobile establishments who are just gonna pop up in one place. The benefit of the mobile year-long permit is that then you can take your vehicle throughout the county without any further inspections, which is why it's subject to additional inspection requirements, if I understand.
That's essentially correct.
And she has plumbing in it, so the ordinance is broad, it's there to protect, and I think it's clear that it's a reasonable request, especially for no cost, it's gonna, no additional time if it can be done concurrently, so.
So I'd like to make a recommendation then that the board accept the hearing committee's findings and deny the appeal, and ask that Director Noem send a letter stating such, including the fact that you did try to reach out to her twice and you haven't gotten a response.
A second.
Any further discussion on this or questions for Kyle or the committee? Sure.
If the,
What's our intent, since we reached out to her, she hasn't complied, what's our next step
She doesn't get a permit to vend in McHenry County.
in McHenry County?
Unless she follows up.
Yeah.
and
Unless she
completes the
does.
process.
So she's not being denied, she just has to
Yeah, she
complete the
just has to
process.
finish it,
Yeah.
right.
Okay.
And she does have another full-time job, so
Okay.
it may not be high on her priority list right now. Winter coming
Yes,
and
winter.
everything else for
True.
food trucks.
are these permits annual?
Yes, we do have seasonal ones, but this particular one she applied for is an annual permit.
And then do they have to have the plumbing inspection each year?
No, this is because it is a new unit to our county. So it is the same standard that we use for new establishments that open that are brick and mortar. That's just typically done by the municipality because they do it as part of their process and confirm to us. Sure.
Okay, thank you.
Any other further questions? Thank you. Darlene?
Mr. Clark?
Motion is to deny, correct? I'm
The
in favor.
motion is to deny her appeal.
Yes.
Ms. Morowski?
Yes.
Ms. Clark?
Yes.
Dr. Katz?
Yes.
Dr. Ansler?
Yes.
Ms. Carmen?
Yes.
Mr. Markison?
Yes.
Ms. Gaffney?
Yes. On to the next item on the agenda. The election of new slate of officers. So my term is up, I've had 3 years. Kyle's had 3 years in his position. He doubts it, but he has.
Three? It changed in 2021, I've got a thing that's showing,
We're talking, yeah, but
okay. I mean, I believe you, but
Darlene knows the stats, I'm pretty.
okay.
You're out, Kyle.
I'm happy with that, I thought Ted was the treasurer in 2021. But regardless, didn't mean to,
No, we have you for 3 years.
okay. Time flies when you're having fun.
That was said earlier.
And Juliana's term has expired. That doesn't mean anyone can go to a different position. Joe is the only one that can retain his position. So I'd like to offer up my position as president to anyone here who would like to accept the scepter for the,
It's a scepter.
what's it?
It's a
It's a scepter.
it's a symbol of a scepter.
It's a box
The best I can do.
To pass it around? Oh, yeah.
Whoa,
The remote
clicker.
control. So does anyone like to make a nomination
I'd like to nominate Joe Clark.
for president?
He's like,
second
what?
I will do it if no one else wants to do it. If someone wants to do it, step forward and do it.
I'm chair of another board, I'm good right now.
Who's not here tonight that we can nominate?
Yeah.
I think it's just Lupe.
Well, there you go.
There you go. She's like, I've been on the board 2 months, and now I'm president.
That's what happens when you don't go to the meetings. So I second Joe's, the nomination for Joe Clark as president. Anyone else want to put
Can you
their
not
hand
do
up?
it again?
Huh?
Can you not do it again?
You just have to
don't
take a
want-
year off. You can't
Oh,
do
okay.
3 consecutive, doesn't say you only 3 and you're done.
Right.
Oh, so these are annual, the president? Is that what you're saying?
Yes.
Yeah,
No,
okay.
no,
No, it's a 3 year.
3 years.
Oh, okay, all right.
Well,
But no,
no, every year we do it every year. I
It's
misspoke.
every year, but you can do it
One-year term, you can do three in a row.
That's correct, I misspoke,
Okay.
that's why I
You have
just
to change
right.
that.
Clarify.
You have to change positions.
Can't get it right.
Okay, all right.
It's only been 3 years, but I still can't get it right.
I would look to do it in the future. I don't want you to feel like you're pushed into it. I just would rather not this year. What's that?
So well, let's put the slate together and vote on the slate as a whole. So we
I
have
will-
Joe Clark as president.
I will offer to, or nominate myself, if nobody wants to be the vice chair, vice president.
That's great.
But then someone will have to be treasurer. I didn't have a choice on anyways, so.
And the treasurer is not a complicated.
Well, especially now that we've hired a financial manager. so-
Any takers? Sarah?
Was it cough?
My understanding of accounting is in the negative.
Listen, I don't balance my checkbook, so.
I just wait for
Like I
the double.
kinda
I'm good at a
Right.
lot of things, but it's not that. Like, if I can get a job description, that'd be helpful.
Yes. We don't even know what these things do, we'll just.
Yeah. So what do you do as treasurer?
Well, monthly I look to review the financial budget.
Oh, I know who'd be great for that.
And just, Dr. Amsler would be great for that. You
That is
catch
true.
lots of.
I would be terrible.
Dr. Amsler, what do you think?
Sure, why not?
Great.
Okay, now we need a secretary. And
And I'm
Darlene
so
writes it all
unhappy
for
about
you.
it.
It's not like
Yeah.
someone writing it.
What
You have
does
to
the
write.
secretary do?
Basically,
For the, just.
bring
Do you have
donuts.
to take notes, like, for executive session?
For executive session,
Yeah.
just take notes.
The secretary is responsible for the minutes, whether it be an open section or executive section. Staff prepares for us, or for the board's secretary, the minutes of the open session. But when it comes in front of the board, it is the secretary's minutes that is being introduced and that we are voting on. Even though staff prepares and does a very good job in the preparation. The secretary should, before the meeting, review the minutes to make sure that they are acceptable to him or her. Does that make sense? Okay.
And like for executive committee, it's very, since it's still like executive session, I don't know if you've noticed, like they're very vague and just not, it's not like you're writing detailed, this,
Yeah. Who
This
was
was
there?
just- who was
What time
there?
it was.
Yeah, like this,
Because there's
There's no
there's
issue.
no voting in executive
yeah,
session, so.
so.
And it's
I've done
recorded.
it, I used to be the village clerk.
She's nodding, she's nodding.
You like to do it?
Me? I'm not nodding. That's a question.
I mean, I
Turns
wrote,
out you ask questions, you
I
press
did
enter.
minutes for the village, so I can do
I'll
it.
nominate Dr.
Cecilia, all right, there we go.
Second, Cecilia.
All right, so let's read off the slate. President Joseph Clark, Vice President Kyle Markison, Treasurer Dr. Amsler, and Secretary Cecilia Carmen. Do we have a motion to approve the slate of officers?
To approve, not improve.
To
Approve it? Yeah, we'll get your name on there.
We have a second, did you say you seconded it? Thank you. Arlene?
Mr. Markison?
Yes.
Dr. Katz?
Yes.
Ms. Clark?
Yes.
Dr. Amsler?
Yes.
Ms. Carmen?
Yes.
Mr. Clark?
Yes.
Ms. Morowski?
Yes.
Ms. Gaffney?
Yes. Thank you. And that starts when? Just so we know, January 1st?
January, yeah.
Okay. Great, thank you. On to the committee assignments. Darlene, I know we had a couple of vacancies, correct?
We have a vacancy in the Finance Committee. And, let's see, I think we have enough for personnel. We have
Chair shows vacant.
6 in regulations, so I don't know if we need 6.
The one that you
But we do need finance committee.
the one that's listed up there, linked up there, shows a vacancy in the chairman spot of regulation.
Which one are you looking at?
Yes, there is,
Oh, yeah.
for the regulation ordinance, promotion and planning committee, there's no chairman nominated for that.
Oh,
Chair Star.
I'd like to make a suggestion, because the president is supposed to be an ex officio member of the committees. That's gonna affect a couple of committee assignments that I was on. So there's gonna be some changes to these committees. Can I ask the board members to, if they have a desire to be on finance, personnel, regulation committee, to send a message to Melissa of your desire of what committees to be on, and Melissa will then forward it to me, and I will review that input and bring to the board a recommendation for committee assignments
in January.
in January.
Great. So we'll table it till January. Thank you.
We should be on how many? 2, 3?
It should at least be on 2. Every board member should at least put 2 requests in. And then
And Darlene, if you could,
I'd like to throw out our, as an idea, the hearing committee. That is a very important, very infrequently used committee, but it is, like we just heard this evening, when someone in the public is appealing performance of our health department. And so it is my thought that the 5 most senior board members should be appointed to that committee automatically.
yeah, I plan on staying on.
Senior meaning time on the board.
Age. That counts, I am in both categories, I'm in both.
Are we supposed to, if we want
outta
to
here.
stay on committees, do we still, if I want to just stay on my committees, do I still send that to you?
Send it to Melissa.
Oh, send it, so just send, okay, all right, so everyone needs to send, okay.
But you're gonna have her, Darlene is gonna send out an email with the current listings to
Okay.
everybody again, and then ask for their response.
Okay, perfect, all right, thank you.
All right. Any other board issues for this evening? No? Anything?
I do have
Yeah.
I don't know if this is the right time to bring it up, but I'm on the opioid harm reduction thing. And the deaths are astronomical the last couple of months. And we're trying to figure out ways to get information out. For example, we use their public relations person here to get stuff out, but it's like a public service announcement on the McHenry County radio station or in the newspaper, if anybody knows anybody in the paper that they can put a thumb on them. And because it was online and it was like a small, it wasn't, I'm ringing the alarm bells with these. I mean, 8 deaths in 1 month is a lot. And for 2 months consecutively, that's a lot.
Do you find it, do the stats show that it's cyclical during the holidays or the winter months, or it just?
It's just been increasing, and it is, I mean, it's worse during the holidays, and people try to tone themselves down come January, but yeah, I mean, the fentanyl and stuff, I don't know that there's so much xylazine, do you know? I don't think there's as much xylazine as they had thought at first was gonna come in, but that will be coming, and that's really ugly.
Dust is yet to come.
There's no antidote, and people get really sick with it. They get really horrible wound situations. And a lot of public health departments are actually setting up their own wound clinics for them, being referred from the hospitals, which I thought was kind of, but I mean, we're talking about big city. I think Chicago's doing one, New York City's doing one, Newark is doing one. But I don't believe we would have the resources here for that, but But that's in the future, something to think about. But I mean, I was just pretty stunned with those numbers.
Do we, and I haven't looked at, do we have an emergency contact on our website for that?
For
Just information
specifically.
of someone having,
Well, I would think it would be on the website because we now have 3 vending machines.
Yeah.
Where you can get like
But
MCC.
I guess you mean for somebody that's in crisis or?
or someone that knows someone that's gonna be having a
Yeah,
problem.
the press releases all have link people to resources and
Okay.
how to get help
Okay.
and how to get Narcan. Maybe you're asking like, does it need to go further?
I don't know, I think it needs to go further.
You know, and the problem I hand out this paper, and it's like, here's your resources, and here's where you can get Narcan, basically. When I first started handing out, everybody was very, let's do it. But I was a little taken aback. I went to the Y and said, can you have a training for your staff? No, we're not interested. So if people know people and they can put a little pressure on them, it's more of a word of mouth thing. Oh yeah, I really should have this Narcan training for my staff, especially the staff at the health clubs. I mean,
Which Y?
And the
that
one in Crystal
Foglia?
Lake Sage,
Sage.
in Crystal Lake.
Yeah, who did you talk to there?
I talked to, I've got her email, I can't remember her name, but anyway, she talked to the executive director, who I'm not familiar with, and they just denied it. So, I mean, I was just a little, if we just had a little pressure from the board, I think, on people you know, or, can you do this, can we make it more, especially with the kids home over the holidays, that's what really bothers me,
Yeah.
The age group is actually 18 to 45, 39 males, but that doesn't mean kids won't get into it, or somebody's coming home and wants to party the day after Thanksgiving or whatever, it's an issue.
Now, do they have a vending machine?
3.
They have
There's one at
3, and they're not
MCC.
willing to learn how to
MCC is like constantly
No, the
being
Y
refilled.
does not,
The
the
Y
Y does
does
not
not.
have a machine.
The Y doesn't.
We have 3 total machines in the county.
MCC, Other Side, and YFC?
Harvard.
Yeah, Youth and Family Center.
Yeah.
CHP and
But I'm wondering, since a lot of the, bars and like especially the bars that, they are connected with health department, if they could send like that flyer, okay, post this, or, put it in your like employee newsletter.
That's a good, I've never gone to the bars, I mean, I've kind of hit all the stores and
Yeah,
the health clubs and stuff.
yeah, because I did talk to I'm friends with the owner of Duke's, and he was kind of, he was reluctant too, but he did get like that flyer that came out about, where to get it. He did give that to his employees, like an employee, like newsletter, the emails. But I was gonna push him again, because I was talking to, so Lolly, what's that, Life for Lolly?
Live for
Live for Lolly at the Green Expo, and they were like, oh, we'd love to, to do more training, so I was gonna kind of push him again.
The training for staff, I think, would be really good. The filling stations, pardon my old term, really need to have it, because they find dead people in their bathrooms a lot. Not necessarily in this county, but that's kind of a common place to be dead. But, it's just kind of getting the word, even the flyers, if you hang the flyers up.
Yeah, in the bathrooms, yeah.
Exactly,
Perfect,
just
yeah.
like the domestic violence
Yeah.
flyers that you put in the bathroom, so it's
Do they have a
anonymous.
QR code on them where people can just scan it?
Yeah, well,
And
Duke's Ale House
Duke's
does have now
people-
Narcan in the back. So I did give them one, so they do have it there, so.
Yeah, so I would appreciate if anybody knows anybody,
I know someone,
know a guy?
a reporter at Northwest Herald, so.
Yeah, I mean, I was happy that they wrote about it, but I thought we would, even the Daily Herald, I mean, but it's all owned by the same company.
Yeah.
I feel frustrated by.
Yeah.
I feel frustrated by
Sure, that's a yes.
lack of understanding. Like we're not
Much, much better than it was.
we're not saying that
Right, the people that walk into your establishment are heroin addicts, we're just saying, this is a problem that you never know, you might be in front of you, and you should be.
And from people who are like huge community leaders of huge community organizations.
That's the thing.
So more awareness and understanding what Live for Lally is trying to do, what the Substance Abuse Coalition is trying to do. Not condoning, we're not walking around town condoning
This has
substance
been a
use.
long-standing problem in this county. I mean, I remember 20 years ago working at McHenry and we weren't supposed to even say the person was on heroin. We weren't even supposed to say it. I mean, I don't know how you could not say it. It's a medical report or, a coroner's case, but it was, and we're like, we're really kind of getting a lot of kid death in here, teen kids and stuff. And now, I mean, I was very surprised when I started going around to establishments how almost to a person, everybody'd say, well, yeah, I know somebody, or one woman started crying. I don't know if she had a child or a relative, a close relative or something, and thank you so much and stuff. But it's the next level up that I want to get.
Yeah.
Like you said, the community organizations, if they could, I don't know, I'm not a PR person I don't think like that, so I'm kind of throwing it out there for ideas from folks.
Yeah, I know that NAMI is trying to target like men's establishments just with suicide prevention. So like Farm and Fleet, Ace Hardwares, gun ranges, places like that.
And just men's stuff.
So
Ace Hardware.
I didn't mean it, no, I meant like.
Gun range.
Grocery store,
Weight shop.
I know.
The leather workers are.
I'm not wrong.
The houses of prostitution.
We're following statistics. Okay. Following statistics.
Kyle's making some bread.
I'll make a
motion. And trying
To
to.
40 males, I mean, that's what that's all they're seeing, but that's where the numbers tend to be lying. So if anybody has any ideas, and if you know a guy.
Well, I'm done sharing ideas, especially guys.
I doubt that.
Madam President, I move that we go into executive session to review executive session minutes.
Oh, before we do that, I just want to bring to your attention, if you haven't read it already, the McHenry Township Fire Protection District Fire Chief Rudy Horace sent a nice letter to Bridget Hoffman, thanking her for her assistance in putting together the program. So let her know it's welcome.
Nice job, Bridget. I second Joe Clark's motion to go into executive session. Goodbye, staff.
Bye.
Thank you for your time.
Happy Thanksgiving.
Happy Thanksgiving.
Yes, and Merry Christmas.
And Merry Christmas, oh yeah.
Do it all.
What are we discussing? I'm sorry. I missed that.
Executive minutes.
I think we need to take a vote.
Please vote.
Yeah.
Dr. Amsler?
Yes.
Ms. Carmen?
Yes.
Mr. Markison?
Yes.
Ms. Clark?
Yes.
Ms. Morowski?
Yes.
Dr. Katz?
Yes.
Mr. Clark?
Yes.
Ms. Gaffney?
Yes.
Well, we gotta wait for that.
Yeah.